In this birth story episode with Lillie, you are going to hear what a true emergency cesarean birth is like. Welcome to the All About Pregnancy and Birth podcast. If you're having a baby in the hospital, you are giving birth in a system that too often takes away power from women over what happens in their own bodies. I'm Dr. Nicole Calloway Rankins, a practicing board-certified OB-GYN who's had the privilege of helping well over 1,000 babies into this world. I've been a doctor for over 20 years, and I'm here to help you take back your power, advocate for yourself, and have the beautiful pregnancy and birth that you deserve. This podcast is for educational purposes only, and it's not a substitute for medical advice. Check out the full disclaimer at drnicolerankins.com/disclaimer. Now let's get to it. Hey there, before we dive into the episode, the Birth with Power Pathway launches in May. And if you're getting ready for your hospital birth, you don't want to miss it. It's the updated version of my online birth course designed to get you calm, confident, and empowered. Hop on my email list now at drnicolerankins.com/email to be the first to know when it's live. Hello there. Welcome to another episode of the podcast. This is episode number 265. Whether this is your first time listening or you have been here before, you know I'm glad that you are spending some time with me today. Lillie is a 36-year-old first-time mom living in the suburbs of Philadelphia with her daughter, partner, 2 cats, and 1 dog. She is a board-certified veterinary oncologist. Lillie was induced due to gestational diabetes and preeclampsia at 37 weeks. She was in labor for 36 hours, and just as she was transitioning to push, her baby went into distress and the heart rate dropped below 70. She was rushed to the operating room for an emergency cesarean birth. Her baby was stuck in her pelvis, and it was hard to get the baby delivered. Lillie felt like this was a pretty scary and traumatic birth. Now, like many women who have been on the podcast, or if you're listening to the podcast, you did everything possible, or you're doing everything possible to prep for birth by reading, taking a birth prep course, listening to this podcast. One of the things that Lillie took to heart was learning about all possible birthing situations, because even though her birth was terrifying for her, she still felt prepared because she had listened to the podcast about C-sections and she took my childbirth education class. Childbirth education is so important in helping you prepare for possible things that may come. And if you'd like to learn more about my childbirth education class, the birth preparation course, then you can check it out at drnicolerankins.com/enroll. It's completely online. You can do it on your own time and at your own pace, and with your partner too. There's a 100% money back guarantee. Plus you get lifetime access. I've actually had many folks use it for more than one pregnancy. And if you use the code Dr. Nicole, you can grab an additional 10% off. So check out all the details of the birth preparation course at drnicolerankins.com/enroll. All right, let's get into the birth story episode with Lillie. Well, thank you so much, Lillie, for agreeing to come on to the podcast. I am very excited to have you share your story.
Thank you. I'm excited to share it.
Yeah. So why don't you start off by telling us a bit about yourself and your family?
I am a middle-aged, can I say my age?
Sure. If you want to, yeah.
36-year-old professional in the Philadelphia suburb region.
Okay.
I am a veterinary oncologist, which is a very niche specialty in the veterinary world.
Yes.
I work with cats and dogs. People ask all the time.
Right.
People do actually, they do treatments for their ferrets for cancer, but I don't treat ferrets.
Okay.
So I'm a veterinary specialist. I work in Philadelphia, live in the Philly suburbs.
Okay.
I have a daughter, 5.5 months old.
Okay.
She is amazing. Her name's Gaia.
Oh, I love that. That's a pretty name.
Thank you. And I live with my partner, Paul. And we have 2 cats, Jacket and Pants, and 1 dog, Chalupa. I think one of my cats is actually in here right now. He's not supposed to be.
Right.
Because I checked the room. And yeah, that's pretty much the short and sweet of it.
Alrighty. That veterinary oncologist sounds like a lot of schooling and training.
Oh my gosh.
Yeah.
I mean, it's similar to, I wanted to be a MD first.
Okay.
Before I learned at the age of 14 that there's doctors for animals. I was like, well, why not just do that?
Okay.
It's so grueling. So I was in school for 12 years.
Okay.
I finished my residency in 2018, and that's what brought me to Philadelphia. I'm originally from New York City. Born in Staten Island, raised in the Bronx. Okay. Yeah. So I've pretty much been in school. I'm always learning. You know how it is.
Yes, exactly. Exactly. Oh, alrighty. Well, in order to talk about your birth, we have to first talk a little bit about your pregnancy. So what was your pregnancy and your prenatal care like?
Yeah. So I'm a planner, super type A plus, as you probably gathered already.
And can relate to. So,
so I mean, because of my career and the extensive education, kids were the last thing on my mind for a very long time until I met my partner in 2020. And because I'm a planner, I had to like get ready for it. And that took about 3-4 years. And once I was ready, it was, you know, the usual. I bought all the books. So I bought It Starts with the Egg.
Well, wait, what did you do to get ready in 3 or 4 years? Like what took 3? What was happening? I need to know.
Well, at first I wasn't sure I wanted kids because in my whole life I was about my career. You know, being a veterinarian is really hard. I mean, it's hard to get into vet school. It's hard to get into a residency. So before I met Paul, kids were like not even really on my mind. Okay. So I had to like mentally prepare myself. I had to go to therapy, work through some stuff, and then, of course, academically learn about fertility. And because like I would track my periods, but I never really knew what that meant. And I wanted to do things the right way. I'm air quoting because I know that that's not a thing. Like if anything, motherhood has taught me there is no such thing as perfection, but this is past Lillie. So I bought all the books. I like tracked my cycle. I bought the Clear Blue fertility test. I test my progesterone. I was like militant about everything. And I was like, we have to have sex now. Okay. Went to my OB a year ahead of time. Which is actually very relevant to my story. So a year before I started, I was, again, planning. You know, I want to conceive in a year. It's probably noteworthy to say that I have comorbidities that I also was afraid affecting my pregnancy. Another reason why I was hesitant to get pregnant. So I have chronic hypertension, depression, anxiety, pre-diabetes. So my goal was to find a Black OB because I was very much afraid of all these comorbidities being a problem. Spoiler alert, they were. And you know, with the mortality rate of Black women in the United States, I was very much afraid of dying through birth. So I found a Black OB. She's phenomenal. A year ahead of time. And it was just fate. I Googled her, found her online, and she kind of helped me prepare a year ahead of time, like get me on the right medications and kind of talk me through things. I love that. That was my prenatal care.
I love it. I love how proactive you were about things and recognizing that you had health challenges that you wanted to optimize as best you could before you got pregnant. So that's amazing. I think every OB-GYN would love for their patients to do that. So I'm sure she appreciated it and was like, okay, let's do this. Yeah. So how long did it take you? A long time to get pregnant once you got like into trying?
No. So in my head, it was going to take a year and a half. At that time, I was 35, going on 36, so the dreaded 35, right? Geriatric pregnancy. And I was just like, oh, my ovaries all dying. So, and I heard other girlfriends and colleagues state they had to do IVF and it took them a year, 2 years. Like in my head, I'm like, oh, it's going to take forever. It took 3 months. And I was kind of bitter about it, even though I worked really hard to do it. But I was like, in my head, I was like, oh, it's going to take like a year and a half, maybe 6 months at the least. So by month 3, when things happened, I was like, what?
It just, it all came together and you're like, okay, I'm here. Yes.
So that was pretty funny. And I was like, I don't think I'm quite ready.
Well, it sounds like that was the start of the how things are going to happen the way they happen sometimes. Yes. So then once you got pregnant, how was your pregnancy for you? And then did you have the same OB for your prenatal care?
I did. Yeah. Okay. Thank God. I mean, that was I went to a practice. She warned me a year prior. She said, we are a practice of 7, 8, like it's a large OB practice of rotating OB. So she was like, well, I will be your primary OB. Just realize during, birth and the prenatal care, it won't be just me.
Okay.
So I was forewarned because she figured out, because I was like, I'm latching on to you, you're mine. And she's like, yes, that's fine.
Right.
And I asked her pointedly before I even conceived, I said, do you trust the other OBs in this practice? Because I am not going to die. Like, I just kept harping on this death thing. And, she was just like, oh my goodness, this crazy girl. She explained to me that she's been at that practice for years and she wouldn't be there if she didn't align with her colleagues. Gotcha. So that was really important to me.
Okay.
So the pregnancy was, it started off very tough and pretty much was that way the entire time through till birth. I think I had a week of asymptomatic, joyful time to be like, yay, I'm pregnant. And then quite quickly, I pretty much got every symptom you can think of, except for the hyperemesis. That's what I was also afraid of. Okay. But I was super nauseous like the second week after. And mind you, I found out I was pregnant really early. So because I was type A and tracking my cycle, I got a faint positive. Okay. My cycle was weird such that by the time I was seen by my OB and got my first scan, I thought I was 9, 10 weeks. And she was like, no, you're 7.
Okay.
What?
Okay.
So somehow I don't know. It was just I was earlier than I thought.
Gotcha.
But I was really nauseous, food aversion, crying, breast tenderness. I got that like weird metallic taste in my mouth that I like obsessively Googled how to get rid of. It was horrible. Acne. I mean,
everything.
Everything. Okay. And the first trimester was more so me sleeping. Truly, like all I did was sleep. For the entirety of my pregnancy. But the first trimester, I was like, sorry, Paul.
I'm just tired.
I'm going to go to work.
I'm
going to eat.
And
I'm going to go to sleep. That's it. And thankfully, he's amazing. And he was like, okay. So he cleaned everything. But it was tough. Second trimester, things started to ramp up. I saw an MFM. So I was seeing my OB and my MFMs from the beginning because of my comorbidities. So because of the hypertension, geriatric pregnancy, anxiety, depression, pre-diabetes. And of course, they were like, oh, you're obese because my BMI is not perfect. And I won't get started on that. They immediately sent me to an MFM. So I was seeing my OB MFM with like some regularity. I think it was like every few weeks in the very beginning. Second trimester ramped up. Third trimester ramped up.
Got it.
A lot. And come pants, please. Come my second trimester, I had to go up on my hypertensive medications, start insulin. Things just kind of catapulted from there, but I won't get into that quite yet. Because that goes into the birth story.
Got it. Okay. Well, how do you feel like you were treated during your prenatal care?
Wonderfully. I couldn't have had a better medical team. The hospital I was at, all the OBs, thankfully, because I was terrified, were wonderful. My main OB was correct. They're phenomenal women who were all just so nice and so loving. And I'm like, you see hundreds, if not thousands of pregnant women. And it was as if I was like the first one, they were just all so personable and just so reassuring.
Gotcha.
My MFM, I didn't really deal with him. Funny enough, it was a male. I dealt with his nurses the most. And they were wonderful because I had to get so many non-stress tests and so many ultrasounds and so much blood work that I actually developed a nice relationship with the nurses, and they were just They were so wonderful.
Okay. Well,
my
that's
care was
awesome.
phenomenal,
Well,
even
that's
during
good.
the birth.
Okay.
Like,
Okay. Well,
I'm very blessed. Like,
gotcha.
I got so lucky.
Okay. Okay. Now, were all of the other physicians in the office Black women as well?
No.
Okay.
My OB was the only Black woman.
Okay. Okay.
There was a Black midwife who was present at my birth, but I had never met her until the day I gave birth.
Okay. Okay. Got it. Got it. All right. So it sounds like you were getting, even though you weren't feeling great, you felt like the care you received was top notch.
Absolutely.
Okay. Good.
Yeah.
That's
it was
good.
so wonderful.
That's good. So what did you do to prepare for your birth? I know the answer to this question is everything, but let's get into the details. What did you do?
It's everything. I mean, so I'm a very spiritual person, not religious per se,
same.
but I believe in the fact that things are aligned. Maybe not everything happens for a reason, but there's not a lot of coincidences in life.
Sure.
So I was terrified of birth in terms of like the pain that I would experience.
Okay.
So much so that the first and second trimester, I was like, la, 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 la. I don't want to like hear about it. But because I was pregnant and Instagram's algorithm is just creepy, I came across your account, having never followed you before because I wasn't pregnant.
Right.
And I was like, whoa, it's a Black OB. And that one of your most recent posts, I kid you not, when I found your account was you were giving away your course to 3 winners or a select few winners. And I entered and I got it.
Okay.
And I was like, what? And I was like, okay, well, clearly I need to learn about birth, but I'm not going to do it right now. So I enrolled and it sat for
I
the
get
first trimester, second trimester, and then come the second, I was like, maybe you should start, preparing, because otherwise I was preparing for like each week and what the fetus was doing and all that stuff. And I was like, I'll learn about birth later. But then as time like ramped up, I was like, girl, you gotta
get it. Yeah. Because the baby got to come out my body.
That's the biggest event.
Right.
So I started listening. I was listening to your podcast, but not the birth story episodes. I was like steering clear of those because I was like, I don't want my anxiety to shoot up. So I was listening to all your informational, like the ones where it was just you talking about very specific topics. I listened to those most of my pregnancy. And then around second trimester, I was like, okay, listen to these birth stories. So anything that seemed scary in the title, I didn't listen to it. So I just went through the non-scary ones. I started going through your course and in your course, you were harping on like, you gotta be informed because you just don't know. You just kept saying you're like, birth is unpredictable. And like the perfectionist planner in me was like, I can't hear that right now. So I'm just gonna keep listening to like perfect scenario stuff. And then and then as I got closer, I was like, all right, I need to listen to the hard stuff. So I listened to the traumatic births. I listened to the stillbirths, which, those are hard. I listened to basically, I mean, I tried to like, I was just, my work commute is long. It's 2 hours a day. So your voice was
so
just
you had
like
plenty of time. Yes.
on all the time when I was in the shower, when I was cooking dinner. I mean, all of it. And that was really helpful. But I still in my head was like, I hope that's not me. You know, like even going through your entire course from start to finish and going through the C-section part and all of that, I was like, okay, I know what to expect, but in my head, I was like, it's going to be great. So I did your course, read all the books, of course. I had a doula. I had 2 doulas because they work as a team. They were phenomenal. What else did I do? I did pelvic floor therapy, which turned out to be pointless, I guess.
Well, okay. Why you said just because you think because of what? Well, we'll get into what happened.
Yeah, we'll get into it. But I went to pelvic floor therapy starting the beginning of my third, end of my second trimester. She was wonderful.
Was it covered by your insurance?
It was.
Okay. Nice.
Yeah, it was amazing.
Yeah,
I was like, oh goodness.
Yes.
What else did I do? I think that's pretty much it. I mean, it's a lot.
Yeah, that's plenty. That's plenty. So what are some things that you wanted for your birth experience?
I just didn't want to tear. So I've never had surgery before prior to my birth. I had LASIK eye surgery. So, and to me, my pain threshold was low. Like I was like, I am a pansy. I stubbed my toe. I'm like, ow.
So
paper cut.
You got to know where you stand.
So I was just terrified of tearing. So I was like, I want to give birth vaginally because abdominal surgery to me would have been my first. And I was like, I don't want that. And I know how painful that is as a vet. I'm like, oh my gosh. So I was like, vaginal birth, 0 tearing.
Got it.
or minimal
Okay.
dairy.
Okay.
And of course, I wanted my baby girl to come out healthy
Sure.
and happy more than anything.
Yeah.
I didn't care about it being like at home. I mean, I knew that was not the case because of my comorbidities. My OB was very straight with me. She was like, "You're going to be monitored like a hawk. There's no home births. You will be here in the hospital." I was like, "Yes, I want to be here in the hospital."
Right.
I didn't really have much expectations. That I took to heart from your course, is I was like, I had a plan. I didn't even write it down. Like, you had a part where you had us write it down. And I was like, you know what? I'm just going to internally have these expectations, but I really tried to set myself up so that I wouldn't be further traumatized by the unexpected. But yeah.
Okay.
Low expectations, surprisingly. I know.
Okay. Were you planning to get an epidural?
Yes.
Okay.
1,000%.
Okay.
I was like, there's no way I'm not doing it.
Gotcha.
No way.
Oh, and then I know you said you had been afraid, you were really afraid about maternal mortality and things like that. Did that fear dissipate as you got closer to birth based on the care that you had?
Yes.
Okay.
Yeah, definitely.
Okay.
I went from like being afraid something would happen to me to being afraid something would happen to her, or something would happen to me and I wouldn't be around for her, but not in the way that I was like crippled. Gotcha. I mean, truly crippled before. Gotcha. And I just had a feeling. I was like, they got me. Like, my care crew were so on point. And I called them so many times after hours, and they encouraged it. And, you know, there was one Sunday I went in because I was like, she's not moving as much as she usually is. And they were like, happens all the time. And then, of course, when I went in, she was moving a lot. And they're like, yep, it's the magic hospital air. It happens. So, yeah, my fear did decrease, but it was still in the back of my mind.
Yeah.
And I, you know, because, of course, it's just at the forefront, even with my wonderful care team. And my partner was terrified, too, because I had harped on it so much prior the closer we got to birth, he was like, you might die. And I'm like, oh, no, I didn't mean to transfer.
Right. Oh, bless his heart. Paul was like, now I'm worried. Yeah.
I mean, and it yeah.
So then let's get into, what was your labor and birth like?
Okay. Here's where I'll pull up my notes because it was a lot.
Okay.
So I had a plan to go into my OB that day. So this was the end of November. So 5 months ago. And they were going to do one more non-stress test. I did that. Everything looked good. My OB did my first cervical exam, which I was also afraid of. But I did your trick, and I put my fists underneath my lower back, and that worked. Okay. I mean, it still hurt a lot, but... oh, sorry. I should rewind a little bit. So a few weeks before I was hospitalized. So the beginning of November, I was hospitalized because at my MFM, when I was doing my non-stress test, like I think at that point it was every week, twice a week. I was going to the MFM getting a non-stress test, I think Monday, Friday. So like, it was a lot. Right. My blood pressure was elevated for the first time in my pregnancy ever. Like before it was phenomenally normal. And I was like, oh, thank God. Like, I'm clear. And then all of a sudden it was elevated like 150 over, like, it was just not too elevated, but it was different than it ever has been. So that was on a Monday. And then, that was on a Friday. And they were like, okay, keep track of your blood pressure at home, which I hadn't been doing this whole time because I would go to the doctor so often. I'm like, I don't need to take my blood pressure at home. I'm not going to stress myself out. So I took my blood pressure that Monday after work, which was probably not a good idea because work was stressful. At that point, I wanted to be done with everything. Again, my commute is an hour each way from like Philly to the suburbs. It's terrible. So I got home and I was like, let me take my blood pressure. It was 160 over 90. And I was like, that has to be wrong. So I checked it 3 more times and I got the same result. So I called my OB and they were like, yeah, you should probably come into the hospital and get checked out. Like, so I went in, my blood pressure there was 135 over 65 with like fluctuant elevations. They did full blood work. They checked my urine protein creatinine ratio and that was elevated. I have 360 written down. I don't know if that means it. It doesn't, I don't know what that means. We do it for animals, but it's different. So I was hospitalized on continuous fetal monitoring. They did IV fluids, and my OB, thankfully, she was the one on call that night. And she was like, I was like, oh, thank God. And she was like, you have, what did she call it? Chronic hypertension with superimposed preeclampsia. And she was like, at this point, just to be super safe, we're going to give you 2 steroid injections while you're here, keep you overnight. So they gave me one. Is it 24 hours apart?
Yep.
Yeah. So I was discharged 24 hours later because I got 2 steroid injections. She was like, we're going to induce you at 37 weeks.
Okay.
The initial plan was no later than 39.
Right.
But because of the proteinuria, she was like, or protein in my urine, she was like, 37. And I was like, okay, great. So my due date went from December 15th till November something. And of course, again, the planner in me was like, I'm not ready. I'm freaking out. And I'm like, her room's not done.
Right.
This isn't done. And it's just, and of course, that makes my blood pressure go up and up and up.
Yeah.
So, and then also I started insulin a few weeks before my birth as well.
Okay.
Which the steroid injections did not help with
it will throw your blood sugars all over the place. Yeah.
So I figured that was pretty important to note before getting into my birth story.
Sure.
Fast forward to the day of birth.
Okay.
Saw my OB, got my first cervical exam, and she was like, okay, you're 3 centimeters. 60% effaced. 60% effaced. She couldn't tell dilation because my cervix was too posterior.
Got it. Okay.
But my blood pressure was stable. And she was like, well, she looked at her schedule and she was like, you can come in tonight or tomorrow morning.
Right.
And I was like, well, I'm not ready tonight. I thought you were going to say like a few days from now.
Right.
Like that was the initial plan.
Right.
And she's like, no, based on our schedule, it's probably going to be better for you to either do it tonight or because they already had other scheduled inductions.
Okay.
Or tomorrow morning. And I was like, great, tomorrow morning. And then she's like, ooh, actually, no, sorry, only tonight. Somebody's already booked for tomorrow. Oh. So I'm like, okay. Thankfully, my hospital bag's already packed.
Right.
So I text Paul. He's working from home. And I'm like, it's happening today. And he was like, what? And I was like, get off of work now. Because there's so much stuff we have to kind of move up.
Right.
So they scheduled me for 7:30 p.m. to go into the hospital.
Okay.
This
and
was
you were
around 10 in the morning.
And you were 37 weeks.
37 weeks. That was like on the nose, like that day. I was 37 weeks. They weren't playing around. I was like, okay. So I like got a pedicure. We went out to dinner. I was like, I just need to
just
kind of like
settle
relax.
Yes.
And then I went straight from dinner to the hospital.
Okay.
They did another cervical check. I was 80% effaced, 3 centimeters dilated. Okay. -3 station. So started Pitocin. I didn't want the Foley. Okay. Because of what I learned. So I was very happy when they were like, oh, we don't need to do the Foley anyway.
Yeah, not when you're 3 centimeters. Yeah.
And I was like, whoop, spared. So started Pitocin. That night was all the nights, but that night was rough. I couldn't sleep at all. So anxious and uncomfortable. Like I slept in the delivery room because I had to be continuously monitored. Right. Just the way the hospital set up, it was not a comfortable like recovery bed. It was like the delivery bed that's plastic. And
the labor beds are not. They're not very comfortable. Yeah.
And I like couldn't get comfortable because I had an IV in my hand and a blood pressure cuff on the other arm, and I'm just like, is this how it's gonna be? Okay. So I had to ask for Benadryl. I was like, I can't sleep. It's 1 a.m. And I was like, can I? And they're coming in literally every 2 hours on the dot to check my BG, check my blood pressure, check on baby girl. Right. And I was like, can you give me something? Right. Sure. Get me to sleep. Yeah. They gave me Benadryl and I slept, I think, for a little bit, but it wasn't great. And I was so hungry. At that point, they weren't letting me eat because they weren't sure what was going to happen. Okay. But my lower back was hurting and I was like, I'm starving. They increased the Pitocin and then early that next morning, they increased the Pitocin some more. It went from somewhere around 2 milliunits to 6. Okay. Cervical check happened again. Still 3 centimeters, 80% effaced, but the cervix was more anterior. Okay. They mentioned breaking my water, but they couldn't reach. And I was like, do you have to do that?
It should definitely be a conversation. It's not like an automatic. Yeah.
Right. Yeah. Right. Yeah. And it was a conversation. They then increased my Pitocin some more to 8. And I was allowed to eat breakfast, and I was like, "Thank God!"
Yeah. You gotta eat. You have to have some energy. I mean, it's a long process. You have to have some energy.
And I had your voice in my head, and I'm like, oh, come on. Dr. Nicole said I could eat. But this whole time, I'm very impatient and anxious, and I'm just like, how long is this going to be? Because another thing that you harped on is like, it could be days. And in my head, I'm like 4 days,
Right.
how long is this going to be?
Right.
So the next day comes around, my Pitocin's increased to 10 after breakfast. They were like, you should get out of bed. So I got out of bed. I had a doula on call, but my really good best friend was there with me.
Okay.
We lived 5 minutes from the hospital at that time. So Paul was back and forth.
Okay.
Because he had to he was not working, but he had to take care of the pets. So
Sure.
he would drive to and from, and he had to sleep. I was like, we live 5 minutes away. I'm not going to make you sleep on the sofa if you can actually go home.
Right.
And we don't know how long this is going to take.
Right.
So I bounced on the ball, talked to my friend. We having a good time, chatting. At this point, my contractions were minimal. I think you could see the waves on the screen, but I didn't really feel anything. Yeah. And I was like, this is so boring.
Right.
So bouncing on the ball, chatting with my friend, increased Pitocin to 12. And then around 10 a.m., they increased it to 14. They're like, you should just go for a walk. So I walked around with Paul, sometimes with my friend.
So did they have portable monitors then?
They just took me off the monitor.
Okay.
Yeah.
Okay.
They were just just go for a walk. Okay. She was doing fine.
Right. Okay.
So I literally did a lap around the OB unit or 4 laps.
Right.
Then they increased my pit to 16. The contractions became a bit more regular, but then tapered off. I still wasn't really aware of them. They just felt tightening in my abdomen. I didn't feel any pain, but you could see on the screen. They're like, did you feel that?
Right.
And I'm like, no.
Right.
And I'm like, oh, is this how birth's going to be? It's great if it's this easy. Then they increased my Pitocin to 20. They did a cervical check that afternoon. No change.
Okay.
And at this point, I am getting a little frustrated because I'm uncomfortable. I want it to be over. Yeah. They stopped the Pitocin because then the doctor told me that it can actually what happens? It causes not resistance, but
it's the
receptors get
saturated.
overloaded.
Yeah, and it just stops working.
Yeah.
So it's you have to reset things by clearing it out of your system.
Right.
Yeah.
So they were like, okay, we're stopping it. And I was like, no. But around 2:30 that afternoon, they gave me side attack.
Okay.
25 micrograms, discussed that they won't restart the Pitocin for another few hours. And I was like, all right, sounds good. Fast forward to that night. So I was from the afternoon to that night, late that night, I was not on Pitocin and just kind of moving around, getting back into bed because I couldn't be out of bed too long because, again, I had all these monitors, IV fluids on. That night, I was just crying. I was so tired. I was crying. The dry air in the hospital was making my nose bleed. I started to severely bleed from my nose. And I was like, is this okay?
Right.
And the doctor's like, yeah, it's okay. Just they gave me nose drops.
Right.
But I wanted it to be over so bad. I was like, I'm so tired.
Okay.
And I'm not even experiencing the worst of it yet.
Right.
So I'm and it's already 24 hours.
Okay.
Yeah, about.
Okay.
They gave me more side attacks, another dose of 25 micrograms. So that night started Pitocin. They were titrating back up to 20 microgram microliters. Overnight was annoying again. Nurses were coming in every 1 to 2 hours. I think they were up to 1 hour at this point. Checking my BG, checking my blood pressure, checking the monitor.
Right.
And I'm just like, please, guys. And then the blood pressure cuff kept overinflating and falling off. So that would make the monitor go off. It was terrible. I was like, okay, I thought I wasn't sleeping at home, but
now it's just really, okay.
I'm really not sleeping.
Right.
So that morning, my contractions on the monitor had increased.
Okay.
But I still was not aware of it.
Okay.
And I was like, please let this be how birth.
Right.
So I was like, this is great. I can't feel anything. Another cervical exam happened. Those were terrible. I hated those. I knew that they would be tough, but
it was just a lot.
Oh my gosh. Yeah, those were very painful, but I was 4 centimeters dilated, 80% of face, -3 station. I was like, 1 centimeter more? That's it. After all of that, that's it. They recommended I just keep moving. They're like, keep changing positions, get up. Like, you got to get out of bed, stay out of bed. So I would take off my monitors, walk around, bouncing the ball with the monitor, just like doing all the things. And this is the next day, by the way. So this is 36 hours later.
Okay.
Yeah, because like from the 29th to the 28th, 29th. And now we're in the 30th,
Okay.
the morning of the 30th.
Yep.
So I'm just moving all around, doing all the things, like getting really impatient, still not feeling many contractions. But then around 11 a.m., the contractions became more intense.
Okay.
And I was like, oh.
Okay. Like, this is what, all right. Okay.
I was like, oh, we're in business now. Like, this is what I'm supposed to be feeling.
Right.
And I'm just like moaning.
Okay.
And I bought 2 combs with me because I forget where I learned that from. And I'm squeezing these combs. And I'm just like trying to breathe real deep through the contractions and like moaning. And my friend is there and she's like, yep, okay, here we go. Like because the whole time we've been talking, chatting and laughing, and now I'm not responding to her.
Yeah. Because
like I'm just like,
got it.
Focus. Yes. And she's like, okay,
here
we go.
Right.
So I'm doing active range of motion. Contractions become intense at some point. So from 11 a.m. till birth, which ended up being at 2:38, everything happened so fast. So that's why I took notes, because I'm like, one was drugged for most of it, and it just was like rapid succession. Got it. In my head, it was like from 11 a.m. till like 5 p.m., but it was a short period of time when things just escalated. So from that point, my contractions became more intense. I had a new set of team members. So every day, you know this, but I haven't said it out loud. Every day was a new OB, and none of them were my OB. I only had my OB that first night. Got it. I don't think I mentioned that. Okay. When she was like, well, if you give birth in the next 12 to 16 hours, it'll be me. And I'm like, that's not going to happen.
Right.
And I was like, I'm not going to get that lucky. Yeah. So it wasn't her. So I had a new team, which included this wonderful Black midwife who I had never met. Okay. Because she didn't do high risk. Got it. Patients, because she's a midwife. But it was her, and she was working underneath one of the OBs who I had met before. Okay. And I had a wonderful nurse, I should mention. I had a rotating team of nurses, but there was this one nurse in particular, Emily, who was phenomenal. Like she was, we bonded so much that they had different shifts. They could be in the nursery, recovery, or labor. Right. And she would request wherever I was after that first night that we were on. Okay. So I actually had her at all parts of my labor, but she was just wonderful. So at that day, Labor Day, it was Emily, a wonderful nurse, the Black midwife, Kelly, and the OB who I'd met. And they were talking about breaking my water again. And I was like a little hesitant, resistant. And Kelly, the midwife, could tell I was going to put up a little bit of fight. She's like, she's Black, she's a sister. She's like, let me be real with you. She was like, it's been almost 36 hours since you've been here. Right. She's like, I'm going to tell you, this OB loves doing C-sections. And she's like, I don't want you to be that. I'm going to help you have a natural birth. Okay. So she kind of like gave it to me straight. Okay. She was wearing a mask, and she like took that mask off, and she was like, listen to me. Right.
She was like, sis, this is what needs to happen. All right.
She's like, I'm trying to help you. And I was like, got it.
Okay. Got it. Okay. All right.
Say no more, because I didn't want a C-section. Sure. So they talked about breaking my water, warned me about the C-section, and that may happen if I was resistant. But they didn't have to, because around 11:08, I'm laying sideways. This whole time I'm like moving in different positions. Paul's there. My doula was called because my contractions were like ramping up. And Kelly, the midwife, was like, call that doula now. Right. Just like, I was just like, going from moaning to like just breathing deeply. I started crying. Gotcha. And then I'm on my side, and I remember this so vividly. I'm on my side. Like, the contractions are terrible. At that point, I was like, I need the epidural. And then all of a sudden I felt like this pop. Okay. And then fluid gush. Right. And I start crying because the contractions went from like, I'd say a 6 out of 10 to like an 8, 8, 9. And I was like, holy crap, like what was that? Right. And then my doula walks in at that moment, and I'm like bawling. Like this whole time I wasn't crying. I was just like moaning and rocking and breathing, and I'm like sobbing. And they're like, what happened? What happened? What happened? And I'm like, I think my water broke. Like, I feel like fluid underneath. So they check and they're like, yep, your water broke. At first they were like, oh, we're not sure. And I was like, what else would it be? What else feels like a balloon in my uterus with fluid coming out? Like at that point, I didn't have any discharge. So that was a little annoying, but fine. Water broke. Doula got there at that moment. She like immediately jumped in, held my hand. Poor Paul. He's like in the corner, like, what in the hell is going on? Because it's my best friend, my doula, the midwife, the nurse, Emily, and then there was a nursing team too, and the OB would come in once in a while as well. So it's just, it's a small room with a lot of people. At that point, I was like, I need the epidural. So earlier that day, frustratingly, Emily was like, okay, the anesthesiologist that's on, I like him a lot. He's really good. And I was like, okay, that's wonderful. She's like, some of the others, like in terms of like technique and stuff. She was like, so he's great. Turns out that was not the case. So I was like, I need the epidural. They came pretty fast. Thankfully, he wasn't busy because that was my fear. I signed the paperwork. He talked to me, cleared the room except for Paul. And it was, I would say that pain of the epidural was worse than almost any part of the story that I'm about to finish because he had to stick me 4 times. And I'm like, I don't know what's going on. I wasn't moving, but he just like couldn't get it the first time. And I'm screaming. Every time he pokes me, I am, it's as if somebody was like literally stabbing me to death. And poor Paul, he's holding me. I didn't know this, but he's looking at the needle go into my back. And I thought he was just holding me and looking somewhere, anywhere else. But I am screaming, sobbing, like boogers, everything on him because I am in so much pain. So much so that by the 4th time in my head, I was like, if he doesn't get it this time, I'm done. He's not giving me an epidural, but he got it. But Paul was watching the needle go into my back 4 times and he got lightheaded. So he turned white and... Somebody noticed, I think it was my nurse. And she was like, sit down. You need to go sit down. Yeah. And they got him some water. And I was like, oh my God, are you okay? Like, what's going on? He was like, I was looking at the needle. I was like, why were you looking? He's like, I don't know. I had nowhere else to look. And I was like, later on, I was like, was it really long? He was like, yes.
Yeah, it is long. Yeah, it is.
So finally, I get the sweet relief of the epidural. After being stabbed 4 times. And I was like, oh, this is great. Like, like they could still feel the contractions, but they went from like a 9, 9.5 to like back to like a 6. And I was like, oh, okay, not that bad. Like I could still feel my legs. I can move my legs. I was more comfortable. But then what I remember happened so quickly, but after the epidural, I felt sweet relief, still having contractions. And I remember they were like, ooh, we need to move you. Like I was in a position, they're like, we need to move you with this. Everybody's looking at the monitor. I'm just like in a daze because I'm like, oh, relief. But they're looking at the monitor and they're like, we need to move this way. So I'm assuming that's when her fetal heart rate started to decrease. Because they were like, nope, okay, move again. Okay, now move again. And then I think her fetal heart rate recuperated and they were fine. Then very quickly I became nauseous and I was like, I'm going to vomit. So they like lift the bed up all the way. And I'm like vomiting into the bag. And my best friend who's had 2 kids is like, yay, good. That's great. She's like, this means like you're getting close. And I was like, what?
Yeah,
like, I don't remember learning about this, but maybe I did. I just couldn't remember. But I'm like sick, like nauseous, throwing up all the Gatorade because they didn't let me eat that day. They only let me have Gatorade. So I threw up all the Gatorade. I forget when at that point the cervical check happened, but I had one last cervical check at this time. And I was 10 centimeters, 0 station. And I was like, woohoo. So I think that was before I became nauseous and vomited. So everyone was like, yes, it's time to push. Like that means she's coming. And then all of a sudden shit hit the fan and I'm sitting up vomiting into the bag and they're like, you need to lay down now. So they like grab the bag out of my hand, lay me down, and there's like 5, 6 people in the room just staring at the monitor, not saying anything, like quiet. And Paul is just lost. I'm lost because I'm not looking or asking questions because I feel great and nauseous at the same time.
Right.
I'm like, oh, I don't feel pain. And then nothing happens for a little bit. Again, it's just really unclear what happened. In my chart, because I read my chart as a vet, I'm like, I'm going to read my chart and see.
Right.
She wrote that I had a category 2 fetal heart rate tracing. And I remember seeing that her heart rate was 70, which is, I know, not normal.
No, it's not.
Very bad and dangerous.
Yeah, that's quite low.
So at that point, or maybe it was before, again, I don't know when, the anesthesiologist comes back in the room. And he's like, hi, it's me again. And I'm like, oh God, like, go away.
Right.
And he's like, I'm going to be the one doing your C-section. And then Kelly, the midwife, was right there. And she was like, we haven't talked to her about that yet. And I'm like, I'm sorry. What?
Oh.
So he awkwardly like backs out of the room. And I'm like, what is going on? Because again, no one's saying anything. They're just staring at the monitor. And last time I heard, I was 10 centimeters, 0 station.
Right.
We're about to push. But they had me lay down. I could not move. They were like, stay in this position. And then the doctor comes in and she's like, her heart rate's really low and I may need to do a C-section and I don't have time to give her permission except for right now. So here's some forms. She goes over hemorrhage and all this stuff real quick. I'm drugged. Everything's happening fast. I just signed. I was like, sure, whatever. Just make sure that I survive this. And she does too. And this is when I start getting terrified.
Sure.
I signed the consent form. I think it was like not that long between me signing and them literally, as you have said on your podcast and your course, they start ripping the cords out of the wall. Yeah. And I'm like, oh, this is what Dr. Nicole is saying. Like, this is an emergency C-section. Yeah. So I'm assuming her heart rate must have just stayed low. And they were like, we got to go. Like, so much so that I think I had my hands on the railing. They're like, move your hands. Like, they just like whisked me into the room. And poor Paul, he's like, no one's talked to him. They don't have time. Like, he was just like, he knew that I was getting a C-section, but he had no idea why and what was going on. He's not medical whatsoever. Sure. I kind of had an idea what was going on. Right. So I was taken in at 2:21. Okay. And I think all of this happened between 11 a.m. and 2:21. I remember being in the OR and weirdly enough, the night prior, I don't know why, but I was like, I need to like look at Dr. Nicole's notes on C-section because that's one of the parts I skimmed. Right. And like kind of didn't really pay attention to because I was like, oh, that's not going to happen to me. Right. And I kid you not, I went like to that very specific section of your course on my phone, like, because I couldn't sleep. I wasn't sleeping, so it didn't matter. Right. So like the night prior, I was going through your course on C-sections. I was like, all right, so this is what they do. Okay. Like just in case, because like it's been a while and I don't know what's going to happen tomorrow. Thank God I did, because everything that you said happened except for why I couldn't deliver. So I was on the OR table. I remember feeling so nauseous and freaking out because I'm like, I'm going to vomit on my back and aspirate and die. So I tell the anesthesiology nurse, and the anesthesiologist is next to her. Like, they're giving me, I think, fentanyl, morphine, propofol at one point. I was like, I'm nauseous. And the nurse, thank God bless her, she puts an alcohol pad under the oxygen mask that I'm wearing. And I was like, oh, that worked. Yeah. So that worked. And they gave me on Dantatron IV as well. Because I was just like, I'm going to vomit. And and they were like, you cannot move. Like, clearly you cannot move. So my epidural was increased. I was given fentanyl, morphine, propofol at some point. I think I was given preoperative antibiotics. They did a vaginal prep. Everything was done fast. All I remember is there was a curtain between me and all the action going on over there. And I believe it was the OB. Kelly, the midwife, was assisting her. There was 1,000 nurses. Paul wasn't on to my side yet. They had to get him changed into scrubs and a cap. Right. And then at some point he arrives next to me. Okay. And I remember this moment so vividly. He is like white. He is shaking. I think he was crying. I was so, at that point, I was like, I was so nervous. I was like asking the anesthesiologist, I'm like, I can still feel my legs. Am I going to feel this? Am I going to feel this? Right. And he's like, no, you're not. I'm like, can you make sure I don't feel this? And I'm freaking out because my epidural's wearing off.
Right.
And he does something, probably the morphine or something, or fentanyl or propofol. But like, I go from like, am I going to feel this, to looking at Paul and going, are you okay? Okay. And he's looking at me like,
right. No, like,
I'm worried about you. Are you okay?
Right.
Because like he's shaking and crying, and I can tell he's scared. And I'm like, are you okay? And I'm like, oh, like he's not okay. What are you talking about? Right. So as this is happening, I mean, again, you hear the OB barking orders. She is like, this, do this, that, like things are happening. I feel tugging. Like she goes so fast. And what happened finally, when they get into my uterus, they find that Gaia was severely wedged into my pelvic canal. Okay. Like she wrote in her notes, maternal arthropod pelvis at 0 station. She was wedged into there. Multiple attempts were tried to deliver her head out unsuccessfully. So they're I feel pressure, like somebody's fist is in my vagina, pushing Gaia's head back up because she is stuck.
That's what they were doing. Yeah.
And I'm assuming her heart rate was still very low.
Right.
Because I could hear panic in the OB's voice. Like, and that's when I was like, sorry, can I curse?
Yeah, no, we can just bleep it out. Yeah.
I was just like, oh my God, she might die. Like, but this was going on internally. I had no cortisol spike because I'm drugged. But in my head, I'm like, okay, like this is really bad and scary. One of the RNs had to go beneath the drape. She had small, nimble hands. She was the charge nurse. Okay. I met her because she had to replace my catheter. She was phenomenal. Right. She used her tiny, nimble hands she's the one who successfully got Gaia unstuck. Okay. And they took her out. And this happened, again, they started at 2:21. She was birthed at 2:38. But it sounds like that was a very stressful time. And everything happened so quickly. Her APGAR scores were 3, 6, and 9. And I remember they ripped her out of me after, like, I just feel pushing to get her out, and it's quiet, and it feels like an eternity before I hear her cry. Oh, and I finally hear her cry, and everyone goes, yay! Right. Like, woohoo, she's here. Right. And I'm like, okay, can I see her? And they're like, yeah, soon. And I'm like, I have to ask at least like 5 times because it feels like an eternity before they put her on my chest. And I'm like, okay. Right. Here we are. Right. Like, we have arrived. I was given Pitocin. It sounds like I delivered my placenta naturally. They submitted for histopath. I don't know why. I guess because of all my stuff. And then Paul went to do skin to skin with her. Because I was very much like, at some point in all the chaos, I was like, I want him to do skin to skin. I want you to delay clamping of the umbilical cord as much as possible. Sure. I was like, here's my wishes, but I understand you got to do what you got to do to get her out alive and make sure that I'm fine too. I had a left periurethral laceration they had to fix when they put the UCath in. Right. Before or after my epidural. Okay. So they had to fix that. Then they sutured me up. I think that took... At that point, I think that's when they gave me propofol because it was probably at least an hour, if not an hour and a half, fixing the urethral tear, stitching me up. Right. Things had happened so fast that at some point the doctor's like, hey, we're going to do intraoperative abdominal rads just to make sure we didn't leave anything in you. She's like, I had to go so fast that I want to just double, like they counted the sponges, but she's like, I need to be sure. So they took rads. Nothing was left in me. And then I was finally wheeled into the recovery. Well, I didn't go to the recovery room right away. I went back to the delivery room, got to do skin to skin with her, and then took to the recovery room. And that was my birth. And I don't think anything could have prepared me for that.
Wow. Okay. So that was... You are correct. That was a true emergency C-section. Yeah. And just, I mean, golly. So let me get the easier stuff out of the way. Did you breastfeed at all?
I tried.
Okay.
So because of again, never having had surgery my entire life to having a abdominal surgery.
Sure.
The pain was immense.
Okay.
I mean, even if I'm sure if I had a high threshold per se, it was still tough. So breastfeeding her with the incision was so painful. She also screamed bloody murder whenever I tried to latch her because it wasn't coming fast enough. Also, her blood glucose was low. I think it was like 40 something. I can't remember now, but they were saying stuff like, you know, if it doesn't reach this parameter, we're going to have to put her in the NICU on glucose unless we supplement with formula. And I was like, whatever, supplement, I don't care.
No NICU, so fix that.
I was like, no NICU, bring in the formula. So we started feeding her formula, and I'm like, you know, this wasn't on my plan, but this is easier than trying to breastfeed with an abdominal incision. And her literally going so red and screaming, rearing back. I'm getting conflicting like opinions and information about how to breastfeed from all the nurses as they rotate. It's so frustrating and it's so exhausting. But I did mixed feeding. So I did breastfeeding, pumping. Mostly and formula for the first 60 days of her life. And then at days when she turned 2 months, I was like, I think I'm done with the breastfeeding. It was too much.
Got it. And then what was the physical? You said it was a lot of pain. How else was the physical recovery from your C-section?
It was really hard, especially since they were like, you got to get up and walk now. And I'm like, I'm sorry, what? And they're like, you have to walk. Like you have to walk, you have to pass gas. So it was the hardest thing I've ever had to recover from. And I hope like that's it. But the pain was really tough. They gave me Dilaudid. They gave me oxycodone. They gave me Tylenol, ibuprofen. Nothing really took the pain. Like, I was just like, I want to feel nothing.
That's not.
I mean, that wasn't going to happen. But it was like a lot of bleeding, which I'm glad I was prepared for, that you still bleed even when you have a C-section. But there's a lot of bleeding, a lot of pain. They gave me they gave me like an anticoagulant injection too, and the uterine massages or uterine checks were so painful, not because of the incision. I'm just like, this is just as bad as a cervical check. Like you are pressing on my incision, and they're like, we have to, and I knew that. Like having learned what that was for. It was really tough. The first 3 days were the hardest, but then getting home was still very challenging, like to recover from and take care of this baby. Like I wasn't expecting to recover from a C-section. I mean, I learned about it, but, but I had all this stuff at home for, like the icicle pads and this and that, of which most of it I returned. So I was like, well, I don't really need that. I used the dermoplast for the urethral tear, but that actually healed pretty quickly. That wasn't that bad. It was just, it was really tough.
And how was your doula helpful at all during the postpartum process?
Yeah, I mean, she was there for the very short part of the labor before I was whisked into the OR. She did at-home visits a week after. And we kind of reviewed like what happened, because it was so fast. And I was just so sleep deprived in days. I had to ask my best friend what happened from her point of view. I had to ask the doula what happened. I talked to the OB before I was discharged, but it still didn't make any sense. But my doula was wonderful. She, sadly, she was as helpful as she could be, but she wasn't there for most of it because it was so fast and such an emergency. But she was very supportive afterward. And after that one house visit, that's what I paid for. The package, I could have gotten multiple house visits, but I was like, that's fine. I was texting her like questions here and there, but honestly, I pretty much stopped needing her support, I'd say like 2 months out from birth. But they sent me emails like, oh my gosh, she's like a month old, she's a 2 months old, she's 3 months old, and they would check in. The company overall is fabulous.
I guess looking back, are you glad you did the preparation, or how are you feeling about, because that was a lot.
Yeah, I still don't think I've 100% not recovered, but like internalized everything that happened. I haven't had the time or like the right amount of sleep.
Sure.
But it was really hard. I'm happy I did prepare, especially for the C-section. Having heard birth stories about C-sections and then doing your birth course. I think if I didn't have that, it would have been scarier.
Right.
But I knew what was going on. I just didn't know what was going on with her.
Right.
Especially since the circumstances don't sound typical. The OB, she was like, in my 30 plus years of doing this, I've not seen a baby wedged into the part of your pelvis that she was wedged into.
Right.
And she couldn't really explain to me. I'm like, physical, what do you mean? Like, where?
Yeah, I'm trying to think of a good way to explain it. It's just their little heads are just a certain direction, and it can just be hard to they're just with the bone structure, and it can just be, you're trying so hard to get their heads to move, and it's like socked in. It just won't move. It's actually terrifying.
Oh, so you've had it.
The other side
you've had
of
it happen. Oh wow.
Yeah, it's terrifying, because then you start thinking like running through how I have to get this baby delivered. So sometimes we even will pull the baby out breech, like the other way, because we can't get the head to come unstuck from the pelvis.
Oh
so
my goodness.
If she said that, I can tell it was difficult.
Yeah.
She's probably still, she got some gray hairs.
Yes,
from that,
that's what she said.
Yeah.
That's what she said. She was like, I am so happy you're doing well, and so is Gaia. But she was like, I have not, like, I've aged quite a bit.
Yeah, it'll do it. Yeah.
It was a very emotional recovery from that standpoint. I'm probably going to cry now, because you talk about in your podcast, and in the United States, we don't have good postpartum care for the mother. But another testament to how wonderful my team was, they were like, we're going to see you back in a week to check your blood pressure. So before I was discharged, my blood pressure was very fluctuant.
Right.
They were thinking it was just due to the stress of everything.
Right.
But I went back a week later, and my blood pressure was so high. I was checking it at home. It was so high. And my doula, or not my doula, my OB, my black OB, she was like, you've been through a trauma. It makes sense. She was like, I was expecting her to hospitalize me again because my blood pressure, it was like 160 over 100. It was high, and I was on labetalol and I think another drug at that time. But she was like, I'm not going to hospitalize you. She's like, you've been through a trauma. You have to process it. It was a lot. And she didn't tell me this at this visit, but I think at my final 6-week visit, she told me that the OB who did the surgery called her. And she was on clinics. The clinic and the hospital are very close together.
Right.
And she ran. She was like, oh, it's Lillie. And she told me, she was like, when I first met you and you told me, like, I can't die. Like, she took that in. Like, she took that on. And she was like, I didn't realize she was also afraid of, what I was afraid of. But she was like, they paged me and they told me what was going on with you. And she ran. And my friend was like, oh, that was you. Because my friend was there for that visit. She was like, I saw a black lady run past the OR. Like, she dropped everything. And by the time she got there, she had been delivered. But she was just as scared as I was. And very much relieved that I was okay. But she took that in. She was like, when you told me when we first met that I'm counting on you, to make sure I don't die.
Right.
It was,
Okay. Oh, now we're all crying. Okay. Oh, well then, as we wrap up then, what would you say is your one favorite piece of advice that you would give to someone who's getting ready for their birth?
I mean, listen to Dr. Nicole. Definitely take your course. I mean, you are just so phenomenal and a godsend. I was meant to take your course and meet you. And as scary and traumatic as the birth was, I truly, truly think that if I had not prepared with your course and listened to your podcast religiously, it would have been worse.
Right.
The fear of the unknown would have just been, and I think it was probably not as bad for me as a medical professional because I understood even more so what was going on and what needed to happen.
Right.
So I can't imagine a non-medical professional not taking your course. Like, that's just, you're going in blind.
Right.
So I would say, don't be as crazy as I was, I guess, but definitely prepare, but also realize that you can't prepare for everything. Yeah. You just gotta go with the flow and hope and pray everything turns out okay. And also pick a good team, like vet your medical professionals. Like, as a medical professional, I know the importance of trusting your team, and if possible, if you have the resources, I know insurance can make things tricky. Right. And again, I know I got lucky. Like, somebody's looking out for me to have found the team I found.
Right.
But yeah.
Oh, well, thank you so much. I so appreciate you coming on to share your story. Where can women connect with you? You can say nowhere if you're not on social media anywhere. That's totally fine.
I'm not on social media.
Okay, you're smart. You're a smart person.
Like I am, but I'm not in that way.
Yes, I don't blame you. I don't blame you. Well, thank you so much, Lillie, for agreeing to share your story. There are just so many wonderful lessons from this, and I really, really appreciate you coming on.
Thank you. Thank you so much. This is so cool.
Wasn't that a great episode? I really appreciate Lillie coming on to share her story, and it was made even a little bit more special because her name is the same as my mother's name, spelled exactly the same way. Now, after every episode when I have a guest on, I do something called Dr. Nicole's Notes, and here are my Dr. Nicole's notes from my conversation with Lillie. One is that this was a true emergency cesarean birth. Sometimes people say they had an emergency cesarean section, but most people actually do not have an emergency cesarean. If there is time for you to talk about it or time to wait, if there's 15 or 20 minutes, 30 minutes before you have a C-section, that is not an emergency. It may be urgent, but that is not emergency. A true emergency C-section is when we are ripping the cords out the wall, we are running down the hallway. There's not a lot of time for conversation because we need to get the baby out quickly. So this was a true emergency cesarean birth. Okay, number 2 is preparation does not take away trauma. Lillie said that even though she listened to the podcast and she took the course, this was still a traumatic experience for her. Doing those things isn't going to prevent bad things from happening, or again, isn't necessarily going to take away trauma, but it most certainly can make things easier. All right. Preparation can 1,000% make it easier for you to deal with challenging situations and know what to expect and what to anticipate and how to handle things. So again, preparation doesn't take away things. It actually helps you prepare for things. Something that I see on social media sometimes is that, like, people think you can educate yourself out of a certain outcome for birth, and that's just not possible. Birth is unpredictable and we cannot control the outcomes. There are a lot of things we can control, but we can't always control the outcomes or whether or not it's going to be traumatic. But again, preparation 1,000% helps manage that. So you can check out my childbirth education class, the birth preparation course, at drnicolerankins.com/enroll. Use that code Dr. Nicole to get an additional 10% off. But do please invest in some childbirth education, whether that's books, whether that's a course, whether that's YouTube videos, all of the above, because that preparation will make a big difference. Okay, next up is that you deserve to feel safe. You deserve to feel supported, and you have to ask questions in order to feel safe. This is where childbirth education or the process of making a birth plan can help. I talk about how making a birth plan is so much more than that piece of paper. You really need to ask some questions in order to help you feel safe. And you want to do that during the prenatal period, so you have an idea of what to expect. If you wait until when you go into labor to do that, then that's going to be too late. So ask all the questions during your pregnancy so that you feel safe during your pregnancy, so that you feel supported during your pregnancy, because you absolutely 1000% deserve that. And then the last thing I say is that we get a bad rap sometimes, but there are actually some really great doctors out there, and there are many doctors who care. And in that vein, I want to ask you to give your doctor some grace. Lillie's doctor dropped everything and ran to the hospital to try to be there for her when her C-section happened. Now, on the other side of that, there were probably patients who were in the waiting room who had to wait for a bit while her doctor attended to what was a true emergency. So please sometimes give your doctor some grace. Sometimes things just happen where they need to put their attention in a certain place for a moment. Now, that doesn't excuse some of the long waiting times, and sometimes people are overbooked. There's certainly issues with our system that we can improve, so these types of waiting situations and things like that don't happen as often as they should. But please consider giving your doctor some grace. There are some great doctors who care. There are some great doctors who really want to do the right thing for you and help you have that best birth experience possible. Okay, so there you have it. Do share this podcast with a friend. Sharing is caring, and be sure to subscribe to the podcast wherever you're listening to me right now. Leave me a review in Apple Podcast. I'd love to hear what you think about the show. I do shout outs from those reviews from time to time. Also, check out the birth preparation course, drnicolerankins.com/enroll. So that's it for this episode. Do come on back next week, and remember that you deserve a beautiful pregnancy and birth.
Hi, I'm Kristen Bell. Carvana makes car buying easy. Isn't that right, hun? Dax? Dax?
Sorry, did you know about this 7-day money-back guarantee?
A week to evaluate seat comfiness, you say?
A week of terrain tests? Yeah, I can test the brake pad resistance at variable speeds.
Make sure all the kids' stuff fits nicely?
Make sure our stuff fits nicely.
Oh,
Right. Still need to buy the car. Getting ahead of ourselves here.
Buy your car with Carvana today.